Namaskar, I'm 𝐊𝐶𝐫, your host for today on this special series of diabetes पर चर्चा। और हम आज यहाँ पर डायबिटीज़ पर चर्चा कर रहे हैं और हमारे साथ है डॉक्टर राकेश सहाय सर from Hyderabad. Welcome sir, thank you so much for joining us today. And I have a question for you. I would like to ask you that what is diabetes? What is diabetes and can we taste diabetes at home?
Yeah, so I think diabetes has become very common problem. Everybody in the everybody knows about diabetes, that this is a problem where sugar levels are increased in the blood. That is what people understand about diabetes. But let me tell you that diabetes has become very common today. If you look at the data, recent data from the ICMR India study, we see that we have about almost 11% prevalence of diabetes and more than 100 million people with diabetes in our country, and which means that every fourth or fifth person will be diabetic. If you just randomly select people, they'll one or four or five will have diabetes, and the commonest test to detect diabetes is doing a blood sugar, and blood sugar can be done in different ways. Simple tests can be done at home itself. We don't have to worry about going to a lab, and we have several different glucometers available which can be done, tested at home. Although there will be little difference between what the lab says and what the glucometer says, but we shouldn't worry about that. We should encourage people to check for diabetes, because the reason is that although we say that we have 100 million people with diabetes, half of them don't know that they have diabetes. So it is very important that we ask people to get a test done. After the age of 30, everybody should have a test for diabetes done.
So, what are the normal blood sugar level it has to be? Like, what is the normal level?
Yeah, so when we speak about normal blood sugar level, it can be, when somebody is testing it in the early morning fasting state, that is, he's not eaten anything since the night, and if a person tests at that time, it should be less than 110. And if you do it any time of the day, irrespective when the person is eaten, it should be less than 140. So those are what are normal values. Now, if it is a little above that, between 110 to 125, when the person is fasting, then it is not normal, but it is not enough to call diabetes. Above 125 will be diabetes. And similarly, when somebody is eaten or does it at any time without without reference to the food, then if it is more than 200, then the person can be called as having diabetes. In between these two, you have got a huge range in between that, and those are people who are called as having pre-diabetes. Pre-diabetes means that they have they are not normal, but they are not diabetic also, but they have a high risk of developing diabetes sooner or later. So these are people who should be very careful, who should make a change in their lifestyle and prevent diabetes.
So, we are here for this special series of Diabetes per Charcha. We have with us Dr. Rakesh Sahai sir. Sir, what will be your message for our viewers who are seeing you?
Yeah, so I think the main message that I want to give today is that diabetes is becoming very common. Diabetes is preventable. Diabetes can lead to several complications if it is not detected early. So the main important message is that we should prevent diabetes, screen early, identify people who have any problem, and prevent diabetes. And for that, the most simplest mantra is to follow a healthy lifestyle, eat healthy, exercise regularly, sleep well, and do not have stress. So these things will prevent diabetes. They are very useful, and I think that is the main message that I want to give today to all the viewers here.
Okay.
Regarding the eating habits, I would say that healthy eating habits are our traditional eating habits. Eating home cooked food is good, and even when you buy some food, packaged food, try to look at the labels, because these labels, looking at the label is very important. Understanding how much of sugar is there in a product, how much of oil is there, how much of protein is there, this is important. So look at the labels, make it a habit to look at the labels. Try to use food stuffs which are having less of carbohydrates, more of proteins, and also look at the type of food that you're eating. So have a check on this. It is going to make a lot of difference in terms of your ability to manage your weight and prevent diabetes.